New videos every day.
I'm John Breeding. It's Monday, February 6th in Austin, Texas. I got a call last week that kind of disturbed me slightly. A woman called me and asked me if I did electroshock for 17-year-olds. And I said, do you know who you're calling? How did you find me? And she said, well, I found you on the internet and stuff, which is understandable. My name pops up when electroshock subject comes up, But she obviously didn't know who she was calling, because then I asked her further and she was actually looking for an electroshock doctor who might shock her 17-year-old nephew, I think. And whereupon I took a couple of minutes to explain to her that I was an electroshock abolitionist and that my work was to ban electroshock and to tell her a little bit about the dangers of electroshock. So I kind of took her aback and at least conveyed some information to her, at the end of which she politely said thank you and hung up. So that was troubling, though. But it was just also like, what's going on here? Because that happened right on top of a conversation that I'd gotten involved in a little bit around Oprah's doctor, Dr. Mehmet Oz, who apparently has a TV show now, and had done a little puff piece on electroshock, and a lot of my friends and allies were responding to it. And I was thinking, well, I should give a response to that. And then I got this call asking if I electroshock 17-year-olds, and then decided I need to do this little video today on electroshock in the land of Oz. And then on top of that, I got a call from a reporter that wanted to do an article about electroshock, and he let me know that the Food and Drug Administration, he'd heard, was finally going to come out with a response to the hearings from a year ago when they were reviewing the electroshock machines, and in which I testified, and in which there's an article on our endofshock.com website about that whole endeavor. So I figured it's time to talk about shock a little bit again, just remind people of a few things. Because Dr. Oz's little puff piece basically presented shock as if it was this newer, safer, improved version, totally unlike it was in the past. And that it was this treatment that should be available for people, and that it's not that dangerous and not that controversial, and people are scared of it and they need to be more open to it because it could really help you, and that whole story. And so there's that. And then there's people like Carrie Fisher and Kitty Dukakis. There's always a poster girl or poster boy for electroshock who had electroshock and then testifies that they're somehow better, right? And Oz had one of these women on board as well. Well, I can tell you that the people I know, Leonard Roy Frank, Loretta Wilson, Evelyn Scoggin, these are people who have been electroshocked and know that it severely hurt and damaged them, and have worked really, really hard to recover, and have become part of a large group of activists who had this allegedly beneficial and non-controversial treatment, and who are fighting like the Dickens to try to protect other people from having this done to them. So something's going on here. The basic facts are on our website, endofshock.com, and there's 4 basic points that I just remind people of. One is that electroshock always damages the brain. You send hundreds of volts of electricity directly into the brain, create a grand mal convulsion, and you've got cell death from the electricity and the heat damage. You've got cell death from the breakage of the blood-brain barrier and the leakage of toxins into the brain. You've got cell death from a storm of excitotoxicity from a convulsion, which is why the rest of medicine protects people from convulsions. And the rest of medicine is concerned about potential dangers of electroshock in the building trades. It causes damage. This is most evident and most commonly seen if you don't have actual invasive way of looking at the damage in the brain through memory loss. Electroshock always causes memory loss. It's just a matter of how much. And even the people who testify to the benefits of electroshock, if they're honest, like Kitty Dukakis or Carrie Fisher, will at least acknowledge that, yes, they do have memory loss, but that it's also cumulative. Third point, it does not work. The research, if you really look, shows that you have a virtually 100% relapse over time. Problem in psychiatry doesn't call it relapse because they tell you that you have a disease that you have to live with for the rest of your life. So there's no way of acknowledging failed treatment. It's just called progression of the disease. If the drugs don't work, it's just because you have a really bad disease. So you need more drugs. Then if the drugs don't work, it's called you need electroshock. And then when you go back down again after that, then you need more electroshock, but it's not failed treatment, it's called maintenance electroshock. More damage, more damage, more damage. Because biopsychiatry only has the two things to offer: drugs, drugs, more drugs. And when they leave you addled, the treatment of next resort is electroshock. And that'll guarantee that you don't come back and sue them. Damages the brain, causes memory loss, often profound, doesn't work in the sense of any kind of real healing process and recovery process. And on top of that, it's really not necessary if you don't go down the road of drugs, drugs, drugs that damage the brain. Depression responds to a lot of things, like exercise, like sleep, like rest, like good nutrition, like emotional and social support, like going through grief and loss until you start to come out of it, like discharging the sadnesses and fears and traumas and upsets until you achieve some degree of emotional recovery, like finding meaning and purpose again in your life, like finding people to connect to and be close to. These are the things that facilitate gradual recovery from depression. I really recommend Linda Andre's book, Doctors of Deception. It's the best book I know that lays out all the history and data on electroshock. And it basically shows that when you look at the actual science, it's what I just told you. Electroshock causes damage, causes memory loss, doesn't work. When you look at the public relations campaign, the latest salvo, which came on Oz's show, so we can call this one Electroshock in the Land of Oz, it's a little PR thing where you have somebody saying electroshock is safe and effective. You have a mom and a daughter smiling because she's doing okay at the moment. You have a doctor in the audience who says we need to get this to more people. Even at the same time that the Food and Drug Administration has said we cannot reclassify these things because you have never, shock industry, demonstrated this procedure to be safe, nor have you ever demonstrated this procedure to be effective, even after decades and decades and decades. The only reason you're still hanging on is because the Food and Drug Administration is mostly a lapdog of the corporate industries and has not held that particular device manufacturer called electroshock devices accountable and has let them slide and slide and slide. One other thing that's got to be mentioned is just related to the fact that psychiatry is at root coercive. And so you not only have so-called voluntary electroshock, you also have forced electroshock, where people are being forcibly sedated and forcibly brain damaged. I can't think of anything more horrific than that. And even so-called voluntary electroshock is really problematic because they don't tell you the truth about the extent of the damage, the extent of the memory loss, the failed efficacy. Plus, typically, people are really vulnerable and they're addled on various 3, 4, 5, 6, 7 psychiatric drugs at the same time. They're not thinking clearly. They're definitely not told how damaging it is. They're definitely not told that the drugs are probably contributing to your problem and that there's a way out, which is a gradual withdrawal from the drugs and a bringing in of physical and social and emotional support in your life. Check out our website, endofshock.com, for the research and the data on shock. And watch out for propaganda puff pieces like the latest promoted in the Land of Oz. Thank you.